Greatest country in the world? We hear this question all the time, but we have to ask ourselves, are we the healthiest? We ranked dead last in 11 of our top allies in quality of health care, and yet we pay double the cost. Numerous studies have shown and determined that the quality of healthcare and the cost imbalance versus other OECD countries. So let's discuss the cost of health. The OECD, which is International Economic Group of 34 member nations, did a 2015 survey to determine the most expensive healthcare systems. The top 3 healthcare systems were the United States, Switzerland, and Norway. Looking at these 3 countries, we find that the population of uninsured doesn't play any role in the cost of its health insurance. In Switzerland and Norway, it's a startling 0% of uninsured people after implementing a national health service that leaves no citizen uninsured. In the United States, there's 12.9% of uninsured people. That's 41 million, 80% of whom are citizens, and 34% are ineligible for government assistance. But insurance or not, you still have to pay the price of your health. In Norway, it costs $5,000 in health expenditure per capita. In Switzerland, it's $6,000, and in the United States, it's $8,000 per person. That's $2,000 more than Switzerland. And some will argue that the cost of living and income plays a role in determining this health, that the United States makes more and pays more on average. But looking at this, the cost of living compared to New York as the 100% standard has the United States at 73%, which is 27% less expensive in general to live in the US than New York. In Norway, it's at 104% for the cost of living, which is 31% more expensive in Norway than the United States. And Switzerland comes in at 125%, which is 52% more expensive in Switzerland than the United States. Gallup determined in a survey for median household income that the US was $43,000. In Norway, it's $51,000, and in Switzerland, it's $86,000 per household for average income. So why does our country pay more than Switzerland and Norway when our cost and income are lower than both? If we look at the cost of healthcare in the United States and why, it helps us understand the reasons why our country pays so much. Many services are more expensive. It consumes 17% of our GDP. In an interview with PBS, Mark Pearson, head of health policy division at OECD, has said that the United States has more services per 100,000 people than any other country. Appendectomies, hip replacements, and knee replacements cost 25 to 80% more than a country like Germany. One factor that has particularly facilitated this expensive cost is the employment and regulation of physicians. Physicians overtest and overtreat due to numerous factors. First, the fear of litigation causes physicians to test for everything, even if it's not technically necessary, should a conflict arise that they cannot be blamed for it. Second, an established payment system allows physicians to be paid more for these unnecessary treatments that they do during treatment. And third, patients ask for more tests and services for a false sense of security that may not be absolutely necessary. So the cost is exceptionally high and is only increasing. It is higher than other OECD countries, and research and statistics support this. We must ask ourselves, is America the greatest country in the world? Can it be without quality health?